further assurance that these researches that are going on are safe and they will not cause any harm to you or to your family members. It is important for you to get that assurance from the government and to be aware that anything that goes in this country that has to do with the health of the people is not something that the government is not aware.
Robert Sambu is the nursing officer and deputy officer in charge at the Fajikunda Health Center.
As a health facility, we feel honored to play host to this open field day. About 2 years ago, we met here to formally launch the start of trials we are about to hear today, after which we had ended and the order coming to an end soon. We have welcomed this tremendous human endeavor aimed at improving children's health and to save lives, not only in the Gambia, but also across the world. We have promised to make you feel at home and have you enjoyed your work and stay here. I hope we did not disappoint you. On behalf of the entire staff of Fajikunda Major Health Center, I'd like to thank and congratulate the entire team for yet another milestone.
This very important trial, recently carried out at the Fajikunda Health Center, is expected to produce a new tuberculosis vaccine, which could stop babies, children, and adults from TB-related cases. Famara Fofana, GRTS.
As the target date for the Millennium Development Goals draws ever closer, the Ministry of Finance and Economic Affairs convened a consultative forum on the post-2015 development agenda. The high-level gathering, as Abdullah Baji tells us, attracted the participation of people from diverse backgrounds.
Of the post-2015 Development Agenda National Consultation. The gathering, organized by the Ministry of Finance and Economic Affairs in partnership with the United Nations Development Programme, aims at creating a platform for different stakeholders and diverse people to speak about issues confronting the present-day generation and paving a way for better frameworks to the different challenges faced. The event brought together government officials, regional governors, as well as activists. This is an activity taking place in a host of countries seeking to come up with better actions after the MDGs target year of 2015. The Gambia, among other nations, is committed to attaining the Millennium Development Goals of eradicating extreme poverty and hunger, achieving universal primary education, promoting gender equality and the empowerment of women, reducing child mortality, improving maternal health, combating HIV and AIDS, malaria and other diseases, ensuring environmental sustainability, and developing a global partnership. Abdullah Bah, Permanent Secretary 2 at the Ministry of Finance and Economic Affairs, described the high-level consultative meeting as one that is extremely important, indicating that the Gambia has done well in attaining some of the MDGs, even though there are gaps to be bridged.
Although the Gambia has made significant progress in attaining some MDG indicators, there still exist some challenges. Distinguished guests, ladies and gentlemen, the specific objectives of the country consultations are to stimulate an inclusive bottom-up debate on a post-2015 development agenda by providing an analytical base, inputs and ideas that feed into 1, intergovernmental processes, and 2, the positions of member states on the post-2015 development agenda, and also build a shared global system on the future we want, with clear recommendations for government, civil society, and other stakeholders.
The acting UN country resident coordinator, Dr. Ahmadou Babagana, lauded the initiative and efforts taken by the government, parastatals, and other stakeholders in reducing some key hazards that hindered the development of the people, while promoting development at all levels by reducing poverty and other infections.
Governments, international organizations, civil society groups around the world have helped to cut in half the world's extreme poverty rate. More girls are in school. Fewer children are dying. The world continues to fight killer diseases such as malaria, tuberculosis, and AIDS. The continent of Africa specifically has realized steady economic growth and improvements in poverty reduction, and has sustained progress towards several MDGs and is on track to achieve the targets of universal primary education, gender parity at all levels of education, lower HIV/AIDS prevalence among 15 to 24-year-olds, increased proportion of the population with access to antiretroviral drugs, and increased proportion of seats held by women in national parliaments by 2015.
The meeting also featured presentations, including one that gave those in attendance an insight into the genesis of the post-2015 agenda and its significance for the people to be involved, especially those at grassroots level. With the theme, "The World We Want," to center around human rights, equality and sustainability, mechanisms have been put in place to ensure that maximum participation is promoted nationwide. For GRTS News, I am Abdullah Baji.
The main surgical ward of the Edward Francis Small Teaching Hospital has been given a new facelift thanks to global properties under estate developer Swami India. Famara Fofana has more on the official handing over of that development in this report.
Of the global properties alongside their counterparts at the Edward Francis Small Teaching Hospital for the inauguration of the hospital's male surgical ward. Speaking at the gathering, the Chief Medical Director of Edward Francis Small Teaching Hospital, Usman Yan, commended global properties for the wonderful job they have done in refurbishing the whole ward with new items ranging from fridges, mattresses, bedsheet, curtains and a computer for data storage and sanitary facilities. Nyan, however, appealed for further support from global properties in the training of their staff as the surgical ward, a critical and busy outfit that deals with all surgical issues. The chief matron, Pate Saho, joined others at the gathering to assure global properties that the donated items will be put to good use. With this refurbishment, Saho was optimistic of a reduction in infection rates. Jere Jata is the development manager of global properties.
Sponsoring the hospital is something that we take very serious. We do sponsor sports, music. We are the first company to fly 5 artists, Gambian artists, abroad to a music concert in London a few months back. And as young as we are, we know without health, you can't do much. So where do we go? To the main hospital of the country. We've been doing this since 2008. Every now and then we'll come monitor the area, see how the world is going, what development can we do.
Dr. Ahmad Lamin Samate heads the surgical department of the Edward Francis Small Teaching Hospital.
Global Properties has been sponsoring this ward for a number of years now, and from what we can see here, the ward is changed. It looks neat, bed sheets are new, curtains are new, and everybody is happy. We wish to use this opportunity to thank the Global Properties for being a very, very good corporate citizen of this country. Now, as we keep on saying, if we sponsor this hospital, we sponsor the whole Gambia.
Yusuf Asanya also added his voice to the discussions during the commissioning of the refurbished surgical ward.
Some choose to do it and some choose not to do it. But we've witnessed that Global Property did not choose the latter. They are doing what they're supposed to do. At least, and healthcare alone cannot be provided by the government. Government also needs companies that need to supplement their efforts. By doing that, as the saying goes, a healthy nation is a wealthy nation. The when a nation is not healthy, that means the nation will not be wealthy.
The opening of the Global Properties Ward marks another development milestone in the quest for healthy Gambia. Famara Fofana, GRTS.
Well, time now to take our first break. When we come back, we take a look at news from outside the Gambia. Stay tuned. Welcome back. The head of the M23 rebel group, Bertrand Bizuimwa, has warned the United Nations against sending troops to DR Congo's restrictive eastern region in a meeting he held in Kitanga. The rebel leader accused President Kabila's government of being favored by the West. But as we hear in this report, the UN says it will not be deterred by the opinions of perpetrators of insecurity in the region.
The president of the DR Congo's M23 rebellion is in Kichanga this week in an attempt to rally support